Also this morning.
It's difficult to go anywhere to do anything, really. Oh, he's hurt himself.
Oh, he's not naughty, he's got ADHD. We meet the mum who's tired of being called a bad parent by those who think ADHD is just an excuse for bad behaviour.
People need to see it before they judge, really. And walk a mile in my shoes before you judge me.
Tired of being blamed for her son's bad behaviour by people who don't know the facts. We'll be finding out some more about living with kids who suffer with ADHD.
Still to come this morning, this may look like a boy who's simply behaving very, very badly, but it's actually a child with ADHD, a condition many still believe is often just an excuse for bad behaviour. We're going to have the full facts for you of one mother's testimony in a moment. ADHD is a condition that affects 1 in 50 children, with 40% of those still suffering symptoms as an adult.
It's been recognised by doctors as genetic, but as one mum tells us, lots of people still don't believe that ADHD really exists.
Jake, come on. No, off there. I'm Emma Morgan. This is my son Jake. He's 10 years old. He was diagnosed with ADHD about 5 years ago. Sweetheart, I don't want to spend the evening at the hospital. Living with a child with ADHD is very, very difficult. It's very, very stressful. It's exhausting.
I can't see it.
I decided to start writing an online blog, mainly to help spread the word of what it's like living with ADHD and to help people understand really what impact it has on day-to-day life. He does everything at super speed.
Then we get hot water.
Yeah, let's put the kettle on. No, babe, we need to break it in half so we don't waste it.
Let me break it in half.
He doesn't act like this in the classroom during the day, but about now the medication starts wearing off. You do get some people that just tell you that he needs a slap or why can't you sort your child out? And it's a condition. I know a lot of people don't believe that ADHD exists, that it's down to bad parenting. I've got 2 children. Both have been brought up the same way. One has got ADHD, one hasn't. Some people need to see it before they judge, really.
That's your fault.
Walk a mile in my shoes before you judge me.
My goodness, a mile would be a very long walk, wouldn't it? Goodness, what she takes on. Just after it, we're going to be chatting to Emma herself to hear her story. But first, we're joined by Dr. Anu Bhatia. Crikey, it's difficult, the challenges she has, isn't it?
It is, yeah. I mean, watching that, it just makes you think. I mean, Emma deserves a medal, really. And it is a very common condition. It's the most common behavioural disorder in children in this country. And there needs to be a bit more awareness about it.
So, yeah, why is that not the case, then? Why is it unbelievable for some people to accept that this is a condition as opposed to just bad parenting?
Yes. I mean, first of all, it's not about bad parenting. It's not the parents' fault. A lot of parents feel they're to blame. It isn't. It's to do with genetics and the environment, but, you know, it's not a result of the parents. And on the whole, they are very patient and they need a lot of support. Basically, it's if you think about your brain as a car without brakes. With ADHD, that's what it's like. If you don't, there's a part of the brain which is responsible for sort of filtering information, for focusing, for concentrating, and that part's not there in ADHD. So you're hyperactive, you're inattentive, you know, you're going sort of 100 to the second. You can't complete tasks, you can't focus, you can't concentrate. And so the way we treat it is by stimulants. So it sounds a bit odd to give a stimulant to someone who's hyperactive, but we're stimulating that part of the brain to actually put the brakes on, so you can concentrate more, you can focus more, and you can complete tasks.
So the medical options are there. One of the challenges, Emma says, is that they wear off by about 4 o'clock in the afternoon.
Absolutely.
Why could you not just give a second dose?
Because of the side effects, and the commonest side effect is insomnia. And I think that's one of the things about Jake, is that he's up all night and he then has to take a sort of counteractive medication, a sedative. So there are lots of different types of medication on the market, and they're sort of short-acting, medium-acting and long-acting. And it's a case of finding the right one for you, because you have to weigh up the benefits and the risks of having side effects.
Are there other things parents can do? You know, the way that we see CBT, for instance, or brain training
Absolutely.
work?
I mean, it's actually the training. It's called behaviour training, and it's very multidisciplinary. So it's about the child, it's about the parent, and also the teacher. And it's sort of rewarding small tasks or setting tasks and rewarding good behaviour and focusing on the things that you can achieve and being positive about the diagnosis.
I should point out, I mean, the behaviour should be quite extreme, should it not? Because I guess some parents might be looking at this thinking, oh, maybe my child's got ADHD, but...
There's a distinction between sort of having a tantrum and being naughty and having ADHD. And certainly if you're concerned or you've got any worries about it, then go and speak to your GP.
And I suppose that's the point Emma, I'm sure, will make later, is that it looks very similar to the outsider, doesn't it?
Yes.
Bad behaviour in ADHD, which is why it's so challenging to deal with. Thanks very much indeed. Good to talk to you. We'll talk a little bit more later on. We are joined by Emma, as I said, whose son Jake has ADHD, and we saw there. That's chatting to her just after 8
Still to come this morning as well.
Some people need to see it before they judge, really. Walk a mile in my shoes before you judge me.
Challenging perceptions of children's behaviour. Find out why this mum of two faces a constant battle. We're speaking to Emma Morgan after
Also
8.
to come on the programme.
It's difficult to go anywhere, to do anything, really. Always hurt himself.
He's not naughty, he's got ADHD. We meet the mum who's tired of being judged as a poor parent by those who think the disorder is an excuse for bad behaviour. ADHD has been recognised as a genetic medical condition by doctors, but many people still don't believe it really exists.
Instead, they blame seemingly bad behaviour on poor parenting. But now one mum's fighting back and is on a mission to change people's perceptions. Here's why.
Jake, come on. No, off there. I'm Emma Morgan. This is my son Jake. He's 10 years old. He was diagnosed with ADHD about 5 years ago. Sweetheart, I don't want to spend the evening at the hospital. Living with a child with ADHD is very, very difficult. It's very, very stressful. It's exhausting.
I can't see it.
I decided to start writing an online blog, mainly to help spread the word of what it's like living with ADHD and to help people understand really what impact it has on day-to-day life. I've got up in the mornings and found the living room to be an absolute tip. It covered in feathers that he'd decided to pull out of a quilt one evening. There have also been times that he's done really nice, sweet things, given me lots of hugs and kisses, and it just then makes it all worth it. He does everything at super speed.
Then we get hot water.
Yeah, let's put the kettle on. No, babe, we need to break it in half so we don't waste it.
Let me break it in half.
He doesn't have a slow. Down. I'm a teacher. He goes to the same school that I teach at now. Normally during the day his medication's working. He doesn't act like this in the classroom during the day, but about now the medication starts wearing off. You do get some people that just tell you that he needs a slap or why can't you sort your child out? And it's a condition. I know a lot of people don't believe that ADHD exists, that it's down to bad parenting. I've got 2 children, both have been brought up the same way. One has got ADHD, one hasn't. Some people need to see it before they judge, really.
That's your fault.
Walk a mile in my shoes before you judge me.
Well, Emma Morgan joins us now, along with Dr. Anna Butty, and we should say that you haven't brought Jake, or indeed your other son, down because this wouldn't be a brilliant environment for him to operate in, and so it's easier for you to talk freely. I mean, you must have the patience of a saint, honestly. I watch what you're tackling every day, and it's enormous.
I have my moments. I try to show patience, but there are times that I lose it, same as anybody would, and then feel guilty afterwards because he can't control what he's doing.
So not only have you got the problem of the fact that you're dealing with this, and so it makes your parenting life very challenging, but then you've also got the extra level of people judging your parenting because they see, you know, the behaviour. That must really add to your emotional problems in dealing with it.
It does. There's a lot of people out there that don't believe it exists, There's even health professionals that won't believe it exists, put it down to bad parenting. They say he just needs a good smack and it will solve it.
And have you, I mean, I'm not suggesting the smacking, but there was one, I think, where he was jumping on the top of the shed, you know, just to deal with those kind of preconceptions head on. You know, a lot of parents, if that was their child, would be saying, not, listen, I don't want to have to take you to hospital, as I think you said, but get down now, in a really firm voice. I mean, have you tried that approach?
I do that sometimes. I get people saying to me, well, just don't let him do it. And short of holding him still all the time, then I wouldn't be able to stop him, really.
Emma's said that she wishes she knew what was going through his head at times like this that we're seeing there. Can you shed any light on that?
Well, it's like comparing the brain to a car that doesn't have any brakes. With ADHD, the part of the brain which is responsible for sort of filtering and slowing down and acting on things, almost like brakes, is absent. So you're inattentive, you're hyperactive, you can't focus, you can't complete tasks. And that's why the treatment is actually a stimulant medication to stimulate that part of the brain to focus and to have self-control and to be able to be more attentive. So, and I think the important thing to realise, it is the most common behavioural problem in children in this country, and it is not the parents' fault at all. It's genetic, it's environmental, but it's not a result of bad parenting, and I think that's really important that parents are aware of that.
Yeah, and you quite rightly pointed out that Sam, your older son, was brought up exactly the same way, which is proof, if ever you needed, that this is a condition and not a parenting issue. What effect does it have on Sam? I guess it makes his life that much more difficult.
He finds it difficult. He struggles to cope with the extremes of Jake's behaviour, because quite often there's violence directed at him.
The sort of thing he'd get told off for.
Yes.
So that must be very hard to understand.
That's the other thing as well. You have to have different boundaries for both children.
Does Jake recognise the fact that he's misbehaving more than other kids? Can he intellectualise
I think he does.
it? Right.
Yes, he does. The problem is that he doesn't then correlate the consequence with the behaviour. His brain just can't seem to cope with it.
Is there any help? Let's look at the help that's out there. I mean, you say that he has medication, but that wears off around 4 p.m. Is there anything else that she could take that would manage it? Because he's up at 3 in the morning.
Yeah, there are lots of things. As well as medication, there's sort of behavioural therapy. So, you know, it's very multidisciplinary. So it's about the parent, about the teachers and about the child. Sort of teaching good behaviour, rewarding good behaviour, focusing on certain skills, trying to complete tasks in certain times. But also, I think it's about looking at self-esteem, because children with ADHD can often be very have negative self-esteem. So cognitive behavioural therapy is very useful. It sort of helps you think about why you're behaving the way you do and try and modify your behaviour in line with what you're thinking.
You say the blog keeps you sane. It does that, I'm sure, but it helps raise awareness. So please do keep it going.
Thank you.
I had a quick look yesterday. It was very interesting and
well, indeed, and I have to say,
entertaining.
I had a quick look as well, and there seem to be a lot of fans. You're a big fan of Dan, aren't you?
Just a little bit.
Yeah, and that's okay. We'll forgive you for that.
Big fan of yours too, Emma.
Thank you.
I
Feel
think you
free
better
to
give
leave
her
a
an
comment
autograph.
on the blog.
I will do that. It's the least I can do. Thanks for coming in. Thanks, Anu, as well.
you.
We'll be talking more about ADHD in the help families living with conditions like that can get on the show tomorrow.